HPCSA core competencies for undergraduate healthcare professionals, not just medical students, but for many other healthcare professionals, which is probably known to all of you. Pharmacy Council has something similar, the Nursing Council too. So here we are looking at things that the council considers core competencies, and they modeled it on the Canadian CanMed's competency framework, saying that a good healthcare practitioner has all of these attributes. They're, yes, a professional, but they're a communicator and a collaborator and an advocate and a scholar and somebody who can do research too. How is that for an extension of what it is we want our students to be able to do? And we've been talking over the last couple of weeks over the Prof opened the session with looking at the book 101 Things to Do in the Ward, especially when you don't have supervision. So instead of packing up and saying, oh, our tut's cancelled because our registrar's got an emergency and we're going to have tea, what could your students do? I want to take one step back before we look at that and say, what is it we want our students to be able to do, number one, and number two, what holds them back? So I'd like you to drop in the chat, if you can think about it for a minute, why you think that students don't immediately default and start doing these 101 wonderful things you can do in the ward. Why do you think they sit around in a group and wait, and then some brave soul says, ugh, nobody's going to pitch, let's all just go and have coffee, or let's go home, or let's go to our jobs, or whatever it is we're going from here to do? So I'm going to leave you a minute to think about it, and I want you to drop in the chat why you think that happens. Or if you're having trouble typing with your fingers, you can open your mic and tell me.
Sure. Could you just quickly repeat the question, please?
Sure. So when students are left in the ward and their TUT, for example, has been cancelled, why do they just pack up and leave the ward and go and have coffee or go wherever they're going, instead of doing those things that are in that book that we were starting to talk about, 101 Things to Do in the Ward? I mean, surely it's occurred to students before now that they don't actually have to have a preceptor or, a registrar or a facilitator to take them around. I'm not suggesting that they go and do a ward round themselves, but I am suggesting that there are things that they could do in the ward if they hang around that they don't do because they pack up and they leave. So Dr. Patel says students by nature are not intrinsically motivated. So that's a thought. Students need to learn to communicate. Yeah. So Christine, that's it. They are unfamiliar with the concept of taking control of their own learning. Yes, the previous schooling is an issue. Mentorship, challenges with time management, and supervision that's not supported. Those are three very different things, aren't they? So you're saying that if they see it as time that they could be doing something else, then that's what they'd rather do. They'd rather take that time and go and do something else. So it seems to me that they're not prioritizing the ward work enough, because they're saying that learning from a book will advance me better than being on the ward. And that surely says something about our assessment system, doesn't it? So Nabila, students don't know the importance of self-directed learning. Yeah, and the assumption that they need somebody to tell them what they need to learn. Okay, and Anastasia is saying they haven't had anybody tell them the other things that they could be doing. So if the registrar is not there, they genuinely don't know what to do. Yes, Ane, they really don't know that they can take their own initiative. Simone, jump in.
Hi, sorry. I just thought I'd put on my mic instead.
Sure.
Could it also be that, like, so I've got a friend in medical schools that she says sometimes they don't do anything on the wall because they're trying to figure out what to do next with the next sets of exams or the next sets of assessments, could that maybe also be a possibility that they're trying to figure out their next step? They're too busy looking forward to not looking at the present of what
So
they could be
that's,
doing.
yeah, that is what I was trying to get at when I was talking about our assessments, because if you've got a test the next day, right, and you know that it's going to be an MCQ test, and if you learn 10 pages off by heart, you're going to do really well, then you're going to go and prioritize that kind of learning rather than staying in the ward and getting the hands-on kind of learning that we feel is the kind of learning that makes you a good medical practitioner or OT or physio or whoever you're practicing to be. So it's interesting that we're now having the student deficit idea of why don't they stay in the ward, when in actual fact all the reasons you're giving me are kind of staff deficit reasons, in that we haven't modeled for them and that we make their exams prioritize different skills than the skills that we're offering them. So Ane was saying maybe they can't take their own initiative because they believe that somebody else needs to be there. A viewer integrating themselves into the system and not knowing what that system is a barrier. So if we're talking about how their learning centers around a community of practice where they are legitimate peripheral participants, everybody heard that language before, what makes them legitimate? And they don't consider themselves legitimate because they don't know what the system is. So they feel outsiders. So they're nervous to do anything in case they do the wrong thing. And I think fear is a big barrier to participation and to learning. Yeah, Stephen, I kind of agree with you. They move from assessment to assessment. So if they feel like an activity isn't helping them to achieve something in an assessment, then they'll move on. And so a lot of these reasons you've given me are reasons for us to try and change the culture of the clinical space, to change the students' perception of their role in the clinical space, so that they'll develop the agency or the ability to be self-directed and to start doing those 101 things. And maybe we can make it easier for them. So what we were, Yanis and I, planning to do this afternoon was develop a list, and Yanis has put together a really cool Google Drive document. So hopefully he'll drop that in the chat for us now, where we can start saying, aside from the book that we did go through and we had a look at, what are things that you know in your own clinical experience where students could successfully participate without getting in the way, but with activities that would assist their learning? And by assist their learning, I mean, that would help them to develop these personas or these fledgling identities as healthcare professionals, which then underscore the learning. So, for example, and if we're looking at pharmacy students, they could in any ward read a patient's chart and do a medicines audit. You know, they could look at dosages and they could look at drug interactions and they could look at clinical effects and side effects. And it would be really interesting for them to look at the prescription history and see how drugs are added, for example, when adverse effects do appear, and maybe the dose of another drug might have been reduced to, you know, that kind of thing. It's a practical example of things we try and teach them in theory that they actually don't ever exercise unless they're told, okay, now we're doing a medicine utilization ward round and everybody must go and do that. And that's something that they could teach their peers as well. So if they're on the ward with a clinical associate or with a medical student or with a physio, they could say, look, my expertise is doing this, and can we have a look at this medicine chart, and you'll tell me what you know and I'll tell you what I know, and that would assist them in being interprofessional in the space as well. So I'm thinking that there are some very, very simple things that we could put into place that would make learning in wards more apparent to students and would give them greater agency, would allow them to say, all right, even if our registrar did not arrive, or even if the consultant had an emergency and couldn't take the ward round, what are we going to do with this clinical time? And also, how do we account for it? So the question for me is, do we then now come back to Yumi and say, students have a certain amount of protected clinical time that they are timetabled to be an award. And if they don't have the supervision that they need, how do they account for how they spent the time? Would they, for example, have to write and submit a reflection of the time they spent in the ward? Or maybe that could be for senior-led or not, self-initiated. How could we start helping the culture to change so that students understand that there are things that they can do in a ward that would not be harmful and that they would be welcome to do? I suddenly heard my voice echoing at me through the headphones, and I thought, that is just too much talking. So the question is this, okay, how do we help students understand that they can do things in the ward by themselves? Yes. So Matty, that is absolutely such a good point. Students are trying to meet hours, then actually learning something in those clinical hours. And the whole point of us saying that our programs are outstanding, and we do, we say that Wits health science programs are exceptional. And why are they exceptional? I think a lot has to do with the clinical training that our students undergo. We have such diversity and such expertise in the wards, and such a range of patients, and so many very generous and giving people that students learn from. And that adds to our excellence. However, if students are just in the wards to sign off hours, then they're not engaging with that concept at all. They're not engaging with the clinical excellence they see around them. And we need to start seeing how we can help students engage with what is possibly their very, very best resource. Stephen.
Thanks, Shira, and good afternoon, everyone. Perhaps another way of doing this is by actually making more present in the curriculum and teaching these competencies more overtly, as opposed to them being part of a more hidden curriculum. Actually focusing on other aspects of the educational project that's not just about clinical medicine. And this is really, I'm just punting the interface with subjects like my own, health system sciences, where we take these things very seriously around developing students' competencies to be able to act in different spaces in different ways, and to give them essentially, when it comes to competence, it's the confidence to be able to enact a competence, and part of that is creating a space for that confidence to develop. Yeah, I mean, I feel quite strongly that medical and clinical programs should learn more about health systems and systems thinking and critical thinking, and within that there's aspects of agency and advocacy, and a whole bunch of other realms that are beyond the clinical that students see but don't necessarily engage with. And yes, that could be one way of kind of, yeah, and even if you put an assessment to it and drove it in that way by saying, well, we want to hear about your experience in this space from this perspective, engaging with people, this is, we want to know what you've learned here, as opposed to just the clinical skills. Sorry, that's just a rambling off the top of my head.
No, but I think you're absolutely right. I mean, here we put up this HPCSA mandated set of core competencies. And then what we do is we want students in the ward who can present patients. And it's of concern that we're then not unpacking what it is out of the rest of the flower that we want. Mervyn?
Thank you, and again, good afternoon to everybody. I definitely agree with Stephen's attitude about confidence and competence. And I think actually we are responsible. We say, gee, the ward round's been cancelled because yada, yada, yada. and we walk out. But we should give them a project, we should stimulate them, we should encourage them, and by so doing, get them involved. Go and review the medicine charts and see the different antihypertensives and find out why there's a difference, or attach yourself to a sister and go and learn how to examine a placenta, just choosing my own discipline, for example. So in fact, you're absolutely correct. We do cancel and then they're left to their own devices, but we're not stimulating them to get involved. And we've got to look at ourselves and how we are encouraging them to integrate into the whole system about being a competent professional and learning to communicate with peers, with juniors, with assistants, with patients. And I think we're not setting the right example. Thank you.
Yeah, so Yanis, I think your point is actually well made, and it underscores what Stephen started with, that if we have a list of possible activities, it shouldn't just be a list of possible, because these are our students now, and we know it. So I like Ane's idea of maybe developing some sort of scaffolded activity of clinical engagement, to say, we don't expect that your ward rounds should be cancelled or that your clinical rounds should be cancelled, but sometimes it happens because we're dealing in healthcare and people have to prioritize. Therefore, if it happens, you then, mode 2, have to do these activities, and we need some evidence of that. And then the type of assessment that we see on the ward has to include I won't say the complication, but also the depth of the other activities, not just the clinical presentation of a patient. Yanis, do you want to unpack us, and then we'll carry on with Stephen?
So, yeah,
and then Daisy.
Just to sort of build on what you were saying and Stephen was saying, I think if we ask students to, so if we actually give them a handbook with lots of it, we unpack all the activities that they might do over a year or 2 years, or the entire program maybe, and that, so they might not obviously have a chance to do all of them, but that they can start adding that to a portfolio, and at the end they sort of get an additional mark or something, for the portfolio, which and some of those activities could be structured around the CanMed's roles around leadership, and how do you develop that in the space, and some quality improvement. So in the document, one of the things that I just as an example mentioned is that you could do mapping patient flow, which can allow help students understand how patients flow through this, a ward, and what can you do to improve that. So for them to start noticing quality improvement, things that they could, maybe later on implement.
That's lovely. I really like that. Daisy, do you want to add?
Good afternoon. It's not adding. It's coming with a similar challenge whereby maybe we can get assistance from this platform. In our case, our clinical space, it's different, whereby you get a student, they need a patient to be able to do their competency. And now the question is, when the patient cancel the appointment, then you get a student and we assign that student and say, assist your colleague. But now in that, when you say assist during that clinical session, the student come back, the assisting student will say, what is it there for me? In terms of getting a clinical mark.
Yes.
So I think maybe I'm in line with the question of when the clinical session is cancelled, what do the students do? So we give them an opportunity, but the challenge that comes back is, what is it for me in assisting,
Yeah, so it comes down to the student's agency, because we're saying if there are no marks involved in the event, so in other words, they can't score a clinical mark for assisting when they're colleague or peer is treating, then is there any value in it for them? Well, not in terms of marks, but yes, in terms of perhaps learning and communication and collaboration and teamwork and all of those things that we want. So it definitely makes us think seriously that students' behavior on the ward, I think is I was going to say is assessment driven, but we could short circuit that at a higher level and try and make it values driven. That the learning experience and the learning that happens on the ward is learning that privileges students rather in their professional practice and in their identity development, etc., rather than just privileges them with regard to marks. So, yes, Daniela, that's cool. The publication, What's Wrong with Ward Rounds. Anastasia, join the conversation.
Thanks so much, Shira, and everyone. Can I just look at this from a different angle? So, with the students on the Nelson Mandela Fidel Castro program, and the fact that they're in the wards and that's their primary space of learning, we have sometimes it's the opposite, in the sense that you have students who spend so much time in the wards. The interns have recognized them to be junior interns and they leave the ward work to them. And then they're doing the bloods, they're doing, all the procedures, they're literally working as junior interns, and then they spend so much time in the ward. Is it possible that it's no longer 101 things to do in the ward, but 101 ways to make the things you do in the ward become useful? So we've had, and I'll just give a practical example. I've had to step in, with the students in their space, and then I say to them, and then they're complaining, we do so much, we're so busy from morning till evening, we're doing this, we're assisting with this, we don't have time to actually read. And then it became a conversation around changing their perspective to say, now you're doing bloods on this 65-year-old woman who's been admitted for surgery tomorrow. Why don't you use that opportunity to speak to her, to find out, to do a mini clip, to do an examination of a particular system, and to do things that eventually end up being learning while you're working. So just wanted to throw that angle in, that sometimes it's 101 ways not to be in the ward, but how to make the time in the wards profitable. Thank you.
Yes, that sounds absolutely lovely, and it certainly resonates with the article that Daniela's just put up, which is, this is the conclusion of the article. So focused attention is really important. And this article is speaking about, is there any value in ward rounds even when the registrar or when the consultant does arrive? And Anastasia, that's what you're pretty much saying. You're saying that when students are on the wards because they feel that their visibility is important, and also that it soothes their sense of whether they're being active enough. And there definitely is a balance between the students who rush home to read up from the books because they know that the exam will be easier if they've done the book learning, than the student who stays on the ward because they feel like they want to show that they've made the effort, but whether that helps them with the exam or not at the end is worrying. So I think that it is a conundrum. But I like the technical suggestions that are coming out of this. So Yanis, can I ask you to drop in the chat the Google document that you started with, where we can start taking these ideas? I mean, I see that Christine's also put an idea in the chat, and Daisy, your ideas too, where we can start just documenting ideas. That's perfect. I finally have my screens actually working so that I know which screen I'm looking at. I hope.
So
okay.
I started.
Yes, go ahead.
I started capturing some of the ideas that around your first question of when students are left on the ward, why don't they continue their own learning? And then here we can maybe sort of write down the ideas around your next question about what do we need to do to change the culture. And I included one example thinking through how systems around interpersonal conflict, something that you could do. And here at the bottom, there's my example of the mapping out patient flow with the description of the activity and the ways that you can approach it.
Wow, that's really cool, because without a doubt, it means extra work, especially for competent clinicians who are really busy on the ward and who experience this kind of thing regularly. So your first example there of the interpersonal conflict, just 4 simple questions, but could be so meaningful for a student's learning. And then looking at your task or activity and then mapping out the patient flow. So the kind of thing that you've got on the screen now is something that we could put together maybe even as a handbook. I mean, we developed 2 years ago a handbook for interprofessional practice, which Aviva can tell you about, ran through the IPC block. And we did get a fairly interesting set of responses, and students did engage with it as an external activity that they had to do, although there were a small amount of marks allocated to it, right, Aviva? And just working through the 3 or 4 examples that they had to do in the handbook made a difference in how they approached, we were thinking, interprofessional learning. And so maybe we could look at the self-directed learning also as a way to start with giving them ideas. So we could develop our own handbook, not 101 things to do in the ward, but exercises to get through. The only thing is then we would have to sit down and decide on, a mark allocation and how many students would have to do and how students would engage with it, etc., which might take away from the idea of how we were learning. Have you ever joined the conversation?
Yes. So, I mean, I'm thrilled that we're even talking about self-regulated learning, because certainly when we have more senior students, that's really where the learning should start. The difficulty is that we're dealing with a different bunch of students. There's a different philosophy and a different take, and the challenge really is about how to promote that. And so looking at our online learning offering in IPC, it's been an interesting journey to see that students don't seem to want to engage in any learning activity unless there is even a nominal mark allocation, and that it prepares them for an assessment. And that's devastating to me, because we really should be learning for learning's sake, not learning for assessment. But
because, to jump in there, and I'll let you carry on afterwards, but my 2 cents worth is, how do you engender lifelong learning if you're going to need an assessment for absolutely everything?
I think when I think about my teachers, I think the only thing that instilled in me a love of learning or a desire to learn was their passion for the subject and the innate curiosity that you would try and instill in your students. But I think sadly, medical education at the moment is very focused on assessment and passing rather than actually learning. And it's been quite a shift for my students to understand the best way to prepare for an OSCE is to be in the ward and be seeing patients. That's been a massive mind shift for them. But I'm not sure how else you would do it.
So that's interesting, because how did you help them come to that mind shift?
Lots of reinforcement. Just by demonstrating to them the kind of things you would ask in an OSCE. It's not something you can learn. You can't learn how to examine the cardiovascular system without knowing how to do it. And you can only know how to do it by doing it a lot of times. And I just stress that over and over and over. And the penny finally drops in the last week of the block. Thankfully, it drops.
And then you start again with a new group, am I right?
Yes, but that's okay. That's okay. The theory component is a challenge, though. I don't know. We're always working to do better, and we'll see from the research we continue to do, Shira, if we can make inroads into creating self-regulated learners.
Very keen to continue with that research. I agree with you. More strength to your arm. Cartania?
Thank you, Shira. Thank you, Aviva. So I just wanted to come in on what Aviva was saying about students only wanting to learn if there is or only wanting to do an activity or look at the content if there's a mark allocated to it. So currently in HSS, so this is not clinical per se, but currently in HSS, we have a professional development session that is for SP, and it's been running the last 3 weeks. And my TAs and myself, we go through on a Friday or a Monday the following week to see who's engaged. And a lot of the class hasn't engaged, but they do show up to our Friday tutorial in-person sessions. And, you know, they're obviously only really going to get it after our first assessment or assignment. And what I noticed with last year's group, which was similar to what we're seeing now, students would only engage with the content when they know it's for a mark. And what I noticed with last year's group is because we're a very assignment heavy course, when you link the content to the assignment after the assignment is due and they all do badly, they come back in second block and do much better. But, you know, Aviva's done such a great job with the students, having them, you know, reinforcing those concepts. But when we try and reinforce those concepts, I think they just don't want to listen.
It's an interesting idea. They don't want to listen, but how do we reinforce what it is we think we're reinforcing? And also, how do we make it important to them? So if they're very marks driven, then what does that say for our interns? And I see Stuart sometimes struggles to be on the call at this time of the day. He's on the train usually, but his research revolves around the experience of transition from final year medical student to first year intern, and how very uncomfortable students find that transition, and why that could be. And my sense is that this is one of the reasons, because they don't develop enough agency as 5th and 6th year students when they're in the wards. And it takes someone like Aviva to drive them to say, it's really important to spend time here and to develop the skills and the confidence in your own skills while you're here. Because when you're out there, you have to rely a lot on yourself and less so on other people. And that gives them, you know, the idea of why they need to put the energy and effort in. But it still comes back to the students' value of what it is they can learn from the environment. So I saw that, Yanis, you were starting to put up, and you gave your example of looking at the flow through a clinic, for example, of patients, and now you took that example down. But maybe we could start with the sheet that Yanis put into the chat, of starting to give some examples. Daniela?
Good afternoon. Thank you, Shira. So I'm going to speak from a clinical associate division point of view, and I'm going to just pass a reflection on. I think with us, that confidence and competence, there's something to be said when, what I've noticed in that being a new profession and having to have that professional identity, that the competence and confidence is because for even when I was a student, we were new, so you needed to be competent, and then you had to have the confidence because you're trying to edge yourself into the space where it's very territorial. It's changed a bit now to the point where it's now about how do you identify your profession? And obviously, if you being competent and confident is going to give a good outlook for your profession, obviously that's what you're going to aspire to be. And if your profession embodies all, so the diagram that you had about from the HPCSA, if your profession is sort of saying health advocacy is key to you being a professional, you know you're going to have to be very competent about that. You're going to be passionate and confident to be a health advocate. If being a scholar is something where professionals around you are seeing it as something to be embodied as a clinician, you know, everybody's encouraging you to seek knowledge, to participate in research. You're going to, that's why I put mentorshiping, but it's role modeled in what you see in your profession, not just, you know, where you're working, but as a student, it's something that's constantly role modeled in your learning as well as what you're seeing out there. So perhaps also it's something to be said as what is happening to our profession out there, that it's not driving, it's making students feel that all I have to do is focus on just obtaining this piece of paper. And once I'm out of this institution, then I don't know how to be all those 7 or 8 components that the HPCSA expects. So it's perhaps, whether it's the reflections, whether it's we use these particular checklists or these tools, but even as ourselves, we should reflect on what do we want to say to inspire them as students, not just for the student journey, but the professional as well. So I think we do a lot of work in terms of we're not to say that it's not important, the student journey, but we know that the student journey, what we're trying to do is make sure that we create that competent, confident professional, because we know that if we don't do that and something goes wrong, once they're no longer in this cocoon of love of WITS, it's a bad reflection on our program. It's a bad reflection on the profession. There's a lot at risk.
I love that pool of love at WITS. We love them. Yeah. So Matty, yes, I think it speaks to a lot of learning theory about how it is we encourage people to take initiative and to be self-directed and to be self-aware and to develop metacognition about their learning. Yeah, and I picked up on you. It's not that you say you give them a stern talking to and you tell them what's going to be important or not, and then you rate them. Even if you're not rating them with marks, you're still rating them because you're saying, wow, amazing. Like in this feedback, do you give positive feedback? Are you enthusiastic? Are you on the same pathway as them? Are you in tune with what their needs are and their concerns? All of those things add to their willingness to do the kinds of things that we want to set them. So my worry about putting together a handbook is that it then just becomes another tick thing that students have to do. And I think a much bigger challenge is for us to work on the emotional engagement that's really necessary to help students improve their learning. And then, yes, it's also necessary to do 2 things. The first one is allay their fears. So if they don't have somebody to take them around the ward, who are they allowed to? You know, how do they know what they can do in the ward? And this comes right back to Stephen's point right from the beginning. If they understood the system of what's involved in a ward, then they would understand where they could intercalate. They might not know that they have to ask the permission of the ward manager if they want to do something unusual. They might not know that if certain patients do or don't allow, students to come and talk to them, or if there are specific circumstances where they should and shouldn't, like infection control. There might be a whole lot of things that they don't understand about the system. And maybe that's the point for us to start, is a little bit of systems theory in terms of the healthcare system, of what it's okay to do as a student, and also legally what you're entitled to do as a student and what you're not. Because I think that's also important. Do you have legitimacy in the space? Can you bring your friend along to a ward round? All those kinds of things. I'm not suggesting we have that kind of thing, because as soon as you put in a negative thing that the answer to is no, then students say, but I saw it written somewhere. So, so we have to be careful how we voice it. But I think part of the issue here is that we're in a balance, as with every balance, that we want to give them alternatives to do, but we don't want to make it a checklist. But we also want them to develop their own self-efficacy and self-determination, and so we don't want to be too prescriptive over what they have to do. Stephen?
Thanks, Shira. I just thought to share also one of the things that we've been piloting in health system science is this portfolio of evidence of learning, which is actually quite a free space where students are encouraged to share their experiences of learning in different ways. And let me just give you a quick example. We start off the course, for example, by putting students into groups, and we explain to students that there's quite a big difference between a group and a team. And we take them through a journey over 4 weeks to move them into a team through norming and storming and forming. And we discuss different aspects of teamwork and strengths within it that each person might bring to a team, recognizing their own faults, getting down to the practicalities of setting up how they might work together. And as an artifact that is produced out of this process, they create their own team contract. And we give them kind of like a template, but we say, listen, this is not set in stone, because any team that you work in the future is going to be determined by what it is you're trying to achieve. So you have to have determined that as a collective, what your goals are for this, for this journey that we're taking you on, and discussed it and articulated it and put it into a document. And they spend quite a lot of time doing this, and they come out with these really fantastic documents. And it's not for marks, but it helps them to, and it becomes an artifact that goes into this portfolio of evidence of learning. What we do in that portfolio is we say to them, well, now explain to us, now that you've gone through this journey with your teammates, we're calling them teammates now, what is it that you learned? What was valuable? How has this, and then they write reflectively on that experience, and that is what we mark. So yes. so in other words, it's how we structure those assessments and the expectation that we have for those assessments, that I do echo your concern that you don't want this to be an additional burden on the student to do this additional work in. It should be integrated into what they're doing in a clinical round in a particular ward, the kinds of issues that emerge that might be particular to that learning space. And there's definitely going to be resonance that overlaps with other things, socially, psychologically, in terms, the stuff that we think through in medical humanities too, why things are structured in the way that they're structured, why certain conversations are hard to happen, so anyway, I guess the take home is that there needs to be a radical refashioning of how we imagine that education to take place. It's to really support this. Thanks.
So it's a curriculum play, actually, not a clinical teaching play. Stephen? Perhaps. Daniela?
I'm agreeing with you there. Sorry, my mic dropped.
Yeah. Okay, good. Daniela?
So I like what Stephen had to say, and I'm just asking, is it how the students then create in that portfolio, is it just written work like narrative reports? Because I always see students with their phones, they are taking videos, pictures, and I wonder, like, a lot of the time, even when we ask for reflections, we're always asking students to write, and I for one, I hate writing, but I'm very good at talking, and I think about how do we give students the ability to, document their learning, but in a medium that's comfortable to them? That's something I've always thought about. Could a student perhaps give us sort of a video? Could they interview themselves? I remember, like in high school, we had many ways in which you could test someone's competencies of language. You had to role play, you had to use creative writing and things like that. So I'm just thinking, where these students love to be on their phones, they love to take pictures, they can be very creative. Is it just to stick to checklists and just narrative reports? Could we use other mediums just to allow them to document their learning and use that as talking points to towards what we're trying to see is have the self-directed learning? Because even when we were students, and I think about our role modeling that happened with the doctors and the interns at the time, it created the self-directed learning. But when we reflect on it and talk about it now, we use storytelling, and I think about how through storytelling we simply talking about how that learning took place, what happened when you saw that patient, what happened around it, what knowledge came out of it. So yeah, that's in a nutshell. What I'm just saying is, could we use other mediums to have them document and create this portfolio that Stephen's talking about, which is a great idea.
It is a lovely idea. Yanis, do you want to come in here?
So thanks, Shira. And Daniela, to that, I think, yes. I think the whole idea of the portfolio is for students to showcase, well, first of all, choose the learning events that they feel matter to them most. And I think that's one of the valuable things about the portfolio is it becomes an individual journey for each student. And I think at some point we can showcase some of the portfolios, because the students come, like you say, the creativity that comes out is mind-blowing. And I think you can allow them to select, well, first of all, do different artifacts. So for example, you can ask them to make a video around administering medication, so the risks and so forth, and they could choose to put that on their portfolio or not. So you could have lots of different activities, but you could also ask them to document in different ways, and that's up to them, to express themselves in a way that they feel is relevant to them. And something that you mentioned and that was mentioned here also around self-directed learning is one of the other things that we piloted it with the first years and then running it through the second and third years. Although we're going to remove it from the first year assignment because we realized it's a bit too stressful from them because they have no idea around self-directed learning. But we let them reflect on their own competencies and so forth, and we give them a list of all the 21st century skills that they need to develop. And they have to carve out their own learning journey around those and use TED Talks and videos and Harvard newsletters and whatever open educational resources they feel that they could learn leadership from, or delegation skills or communication and so forth. They map out in this personal development plan, and they add that to their portfolio and reflect on the so if they, for example, embed a TED Talk on their portfolio, they have to give context why they selected that, but then also reflect on what did they learn from this and what's the way forward.
I really do like that, Yanis. Self-choice is also important. So as Mohammed's agreeing with you too, that using allowing the student to choose what it is that they want to investigate or they want to put together is a big thing. But I also think that there's a flip side, Daniela, that sometimes the students aren't that comfortable with the different modalities that we give them. And I'll give you a cute example where as many of you know, currently running an iteration of the 21st Century Learning Design course, which is essentially a curriculum play course, talking about power skills, all of these, communication, collaboration, etc. And so we go through a skill a week, and we're gearing up to week 3 tomorrow, but there is an assignment due every Monday. And 10 minutes before the assignment was due this week, we're in week 2 of the course now, say, 3 people write in to say, sorry, we've got to drop out the course. You know, life happens, things are too stressful. So I had the lovely job of debriefing these 3 people and saying, you know, exit interview, why are you actually leaving the course? And all 3 of them said that the task we'd given them, which was to develop a Wakelet, so to start their journey as part of their portfolio building, Wakelet is a platform that allows you to gather information in lots of ways, exactly as Yanis was saying, a TED Talk, an article, a sketch, you know, an audio note, lots of different ways of curating content. And they'd never encountered the platform before, and they just found it just too hard to engage with. And so their immediate response was, I can't do this because I'm going to be judged that I can't do it. And so we don't want to stress our students to that extent that they feel that if we give them a task that's just too difficult, that they're going to crash out because of the form, not because of the function. Stephen first, and then Yanis.
Thanks again. I also thought maybe I could just share something that we've been thinking about. We're busy developing this medical humanities 3 years and as an elective at 3rd year level, and you know, we've got this blank canvas where we can craft whatever we like, and the topics and the content is you know, being humanities based is so interesting, and lends itself to many kind of creative modalities. And the one thing that we've kind of settled on, and we're going to present this to our department just to get kind of feedback and ideas, is to have a creative workshop that runs over the duration of a block, of a module, or whatever the case may be. And so the reason why we're doing that is that it's a facilitated process to build confidence around these kind of uncomfortable spaces that people might be put into, where we're asking them to create artifacts of learning, but we don't necessarily give them the skills to do so. But through this kind of workshop process, where we've got quite a lot of time, you know, we want to work with artists or drama therapists or whoever it is, whatever it is that we're trying to work through content-wise, where we support students to work through a process, a journey, and it sits at the center of this curriculum, and it's trying to draw together both the content, the readings, kind of the experiential process with, you know, in this kind of workshop safe space. The first one that we're working on at the moment is creating a body map, where students literally lie on a piece of paper and outline their body, and then they map onto that different aspects of that we're learning about, you know, like where does, you know, when we look about the intersection of gender and race, you know, how does that articulate in your life? And these are quite like difficult things to do, and I think it needs to be supported because of what we're doing. But so maybe it's slightly more radical to what you were saying, Shira, where you give somebody a tool and say we want you to create something. But it definitely is about, you know, there's those kind of levels of support to which you allow that creativity, and where you can also step back, or where you need to be holding hands. Yeah, so we'll see whether that's going to work or not.
Well, I wish you luck. I hope it does. Yanis, come in here. Or was that just an old hand from before? Matty, why don't you just tell us, just before we end, something about what you just dropped in the chat here?
Well, I do have a little bit of a bias against, at the postgrad level specifically, students demonstrating treatment and assessment sessions with their patients. So in occupational therapy, we at WITS present 3 master's courses, and one of them is specializing in the field of psychiatry, so occupational therapy in psychiatry. Yeah, I mean, I've read up a little bit about reflexivity and being reflective, and how that relates to being a self-directed learner. And I mean, at a postgrad level, you should be a self-directed learner more so than I think anywhere else. If you can't be self-directed as a clinician, then we really are in trouble. And so yeah, we're using a portfolio to demonstrate how you have enhanced your clinical reasoning, how you have enhanced your assessment and interpretation of your assessment findings, how you have improved your skills in terms of communicating that to people of your own profession, but also in the multidisciplinary or interdisciplinary setting. And so I'm hoping that at the end of the year, the students have an e-portfolio with artifacts that they choose, just like Jana said, demonstrating the learning activities that meant the most to them, but also demonstrating something of their own clinical competence and skill that is now at an advanced level. Yeah, so instead of me having to sit and watch a treatment demo, that for me is like worse than watching paint dry.
Yeah, exactly. It's like the alternative to 1,000 students coming through doing an OSCE. Yeah,
exactly. And I mean, it speaks also to what Stephen said earlier about radical, but the adult learning word is radical transformation. But
yes.
but that radical change that we need to make in our brains in order to just do things better and not get stuck in a rut.
Yes. So very exciting, that, isn't it? Now, my question to you, of course, is, did you have these thoughts and that prompted you to do a PG dip? Or did the thoughts only creep up on you while you were doing the PG dip? Or how did the PG dip intercalate with your thinking?
No, I've always had them. But I think the PG dip happened because I thought it was a good idea at the time, and then what it did do is it helped to shape and direct the thoughts. So my thoughts used to be a little bit all over the place, and now they're a little more articulate and a little more coherent, I think.
It also gives you a language of description, doesn't it?
Exactly, yeah.
There we go. So, you know what, we have devolved a little bit from 101 things you can tell your students to do in the ward to how do we motivate students to know that there are things that they can do in the ward. I think we were supposed to come with an artifact at the end of this, Yanis, and I must apologize that I didn't work through it, to have all of our ideas documented so that people could use them. But I think that it's been a useful conversation to hear what other people are doing and to think about what other people prioritize. And I do take the lesson. Perhaps, Yanis, you and Stephen at some stage can do a presentation about the e-portfolio and how it intercalates into your students' development with regard to their choices and their reflections, and also the kinds of activities you ask them to do. Because I do think, yeah, that it's important for us to think about those things. Go ahead.
So yeah, I think we would definitely be happy to do a present. Well, I'm sure Stephen would allow me to speak for him to say that you would be happy to do that. But just the one thing that was mentioned on the portfolio was that made me think about what we do is we in terms of the hand-holding. I mentioned that it does require a lot of hand-holding, and the first years actually find it incredibly scary because it's a very new type of assessment for them. And I think for anyone that gets exposed to that, it is scary for them. So we've really scaffolded how to reflect and so forth. But one of the things that I also really believe in, and I do that for all the assessments, not just for the portfolio, is provide upfront feedback. So I would give a previous paper with all my feedback that I would give the students, and students can see, what would they be assessed on and what sort of mistakes are made. So obviously I asked the students for whether I could share their example of an assessment, and I give them a not so good assessment and a good assessment, and I do the same with the portfolio, so students can see what other students are doing, which also puts them to rest a bit in terms of, okay, now I know what the expectations are. And yeah, and then obviously as you go through, we schedule feedback sessions and so forth, but we can at some point speak about that process. I think just with regards to next week's session, so next week I think is a case study session, and the whole idea with the case study sessions is that we would be writing a case study for learning. So we can use that opportunity to work on some case studies that we could give students in spare moments in the ward, and maybe work around the activities. So use this document to take that further.
That'll be absolutely super. Thanks, Yanis. Thanks for coming, everybody, and thanks for engaging and sharing your experiences. This is what makes the learning space just so valuable for all of us. And so I really appreciate your input, and have a good week. See you next one.